everybody. This video is going to be different than most of my other videos. I have an awesome background right now, which is my dirty kid car. I am on my way into work. Anyway, I just wanted to do a video, not necessarily that everyone in the world cares about me currently. I feel like when people do have this experience, the first thing I did last fall when I found my tumor was I kind of went to YouTube to see how common it was. I don't know, it's stupid. That's just what we do. So anyway, this is just kind of for future reference of anybody going through this. Just kind of this video, I'm going to talk about my tumor. It's pretty large, not really a nodule anymore. The size of it, how my biopsy appointment went, what that was like, how my appointment to see my endocrinologist was the first time. Then I recently had another ultrasound and went to see her again. And then at that point she referred me to the surgeon. So I just a couple days ago saw the surgeon and I am booked for my appointment. Once I decided to schedule, I was like, yep, let's do it. And then the nurse was like, are you superstitious? And I said, no. And she goes, I have a Friday the 13th available if you want that. That was her first. I was like, yeah, let's do it. So I took it. So Friday the 13th, I'm going to have surgery and it's going to be good. We're going to change the day. We're going to turn it into a non-superstitious happy day. I'm definitely not worried that it's cancer. I'm just not. Usually they're not. Also, worrying about it doesn't make it not cancer. So I'm absolutely convinced it's not, but if it was, we'll just deal with it at that point. So hopefully it'll just be the one side and no medication. My half a thyroid I'll have left, or kind of a third left, should be able to produce enough hormone for my body. If not, they can always supplement me a little bit if I need a little bit of help, but I'd rather have part of one than not one at all. So one of my tests as far as numbers go, it ranges anywhere from 2.5, sometimes it's 3.5. Recently it's been 3.9, but there have been times when it's been 4.5, 5.5, definitely out of normal range. Definitely would be considered hypothyroid, which might explain why I can't lose any of my baby weight. I don't know. I work hard and eat teeny little bird healthy portions and it's just not going anywhere. So I don't know. But yeah, the idea of a full thyroidectomy does really bother me and scare me because I really don't need anything else making me gain weight and hindering me from losing weight. I'm really hoping our planned surgery is for a partial thyroidectomy. I'm really hoping that we can leave it at that. So last fall, I was putting my mascara on in the mirror, and you know how you like tilt your head back, and I was like, why is there an indent over here? So I went and felt it, and then I felt the other side, and I was like, oh, that's not an indent, there's a huge mass over here. And at the time, I wasn't filming because I had pneumonia. And I was like, well, I have pneumonia. It's probably a swollen lymph node. That's totally normal because I'm a doctor and I can self-diagnose. So I actually ignored it. And then at some point, I'm like, I should look into that. So I Googled, do your lymph nodes move up and down when you swallow? And it came up with the butterfly-shaped thyroid gland with the big old thing on it. And I'm like, oh, crap. So I did go to the doctor like a good girl, and just a regular doctor, and she had said, like, the moment she saw me and she was feeling, and she's like, yeah, that's not normal. I'm gonna book you for an ultrasound. And I'm like, okay, that's cool. I'll do that, and you know, whenever. She's like, no, like, you're gonna walk across the hall and do the ultrasound right now. I was like, okay. So I went across the hall, had the ultrasound done, and then the endocrinologist's office called me and booked me for a regular appointment, I thought. And she's like, we're not going to do a regular appointment. We're going to do a biopsy appointment because that thing's freaking huge. So I waited like 3 months is how far they were booked out. And then they did have a cancellation. So I got in 2 months, but still 2 months. But for a biopsy appointment at some places that can be normal. And I did check around at other locations and they were even booked out further. So this lady over here is going to think I'm a nut job. Sitting talking in my car. Anyway, so I ended up going to the biopsy appointment, and that appointment is going to be different for everybody. If you have a teeny little nodule that is cystic, so it's fluid filled, they're probably going to just pop that needle in there barely. They use the ultrasound machine to guide where they're going so they can see where they're going. They stick it into the little nodule and they pull some fluid out and you're done. My experience was a nightmare. Sorry, I have Phantom of the Opera on in here. I should turn that down. My experience was a nightmare. It was not like that even remotely, because my tumor, nodule, whatever you want to call it, was not cystic. It was complex. So it did have partial cystic components, but then it had like solid components. It wasn't calcified. It didn't have little calcifications or anything in it. But anyway, so what she did is I laid back. Oh, and I'll show you if you watch, it's over on this side. Doesn't look that big, but it's a pretty good one. So it's about 4 centimeters tall. It's about like right here is the top and bottom of it. And it was at the first appointment. It's actually measuring about the same now, except for one of the dimensions has actually doubled, which is why I'll wait for this lady to go by because she doesn't think I'm insane. Anyway, I'll tell you in a minute, the other one pretty much doubled, and that's why we're taking it out. So she takes the needle and she sticks it in there, and she like tries to draw it out, and she can't. And so this is gross. If you're like sensitive, you don't want to watch this, but basically she took the needle and she had the ultrasound over it to guide her. And she was like, jab, 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 jab. And I swear on all that's holy, I felt it in like my spine and the back of my neck. It was just bizarre. And I can't say that it hurt. It wasn't excruciating. It was weird. It was the pressure of weird jabbing motion. It was just gross. It was so gross. My husband went with me. He was holding my hand. I was laying on this table. And so she's just jab, 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 and trying to get stuff out. She's trying to break it up. She couldn't get in there. And then she would turn it. And sorry, my viewfinder's over here so I can see what I'm doing. She'd turn the needle and then she'd jab, 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 jab. I mean, it was just the most nauseating thing you could imagine ever in your life. It was something out of a horror film. And so she gets done, and my husband, I didn't make a peep, but my face went from like relaxed to where I was just, it would get more and more and more like, God, stop, you know? And then he said I was squeezing his hand more and more and more, like tighter and tighter. And then finally she was done, and I was like, oh my gosh, I made it through. I made it. And I have anxiety. I've talked about that a little bit before. These doctor's appointments are not fun for me. They're not fun for anybody, but they're extra not fun for me because I really struggle with just even getting myself through the door and getting in there and sitting down. So anyway, he went with me, and I was like, it's over, that's great. And she's like, okay, that's sample number 1. I'm like, what? So she goes back in and jab, 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 jab from one angle, and then she turns the other angle, and then she's up and down, and she's just desperately trying to get stuff out. And she really struggled to get anything out. So that went off to the lab. I was done with my appointment. I was like, oh my God, that was just terrible. I had a lot of bruising. No numbing, by the way. No numbing agent. Yeah, you might want to ask for that. Apparently that's like a special thing you have to ask for. I didn't get any of that. So nobody cares about my weirdo stories. So anyway, after that, I waited and waited and waited for those biopsy results. Oh, I waited forever for those results. I want to say over 3 weeks I waited. I wasn't worried it was cancer. It's pretty rare that it's cancer. It happens, but the odds are in your favor that it's not. So I wasn't super worried about that. I just was ready to have the results and be done with it. So the biopsy results came in. It was benign, which is wonderful. So that was the end of it. So basically, fast forward 6 months, nothing exciting happened. And a few weeks ago, I was eating some food in the kitchen, and it felt like it was just stuck right here. Like right at this stupid thing, like stuck right here. And I was like, well, that's weird. And it was kind of out of the blue. And then for days and days and days, it kind of just got worse. And I'm like, what in the heck is going on? And then at night, I started to not sleep very well. I called my endocrinologist and I'm like, I talked to the nurse. I'm like, I'm having some swallowing issues. And at night I'm getting less comfortable. I don't know what's going on with this stupid thing, but something's going on. And they're like, okay. So she called me in a ultrasound. She's like, go take an ultrasound today. I'm going to book you for Monday to see the doctor and we'll go from there. So I went in for my ultrasound and then I went to my appointment. The doctor came in and I forgot to mention my first visit with this doctor 6 months ago. She was hilarious. So after the first ultrasound, I went to see her and she's like, eventually you'll probably need surgery, but you can do what you want for now. But the second she walked in the room, the first thing she said was, "Ooh, that's a good one. I could throw a dart at that thing and not miss." That's literally what she said. And just really, really funny and nice, not unprofessional. She was hilarious. So anyway, that was my first appointment. Really we didn't go over a ton of stuff. It was the biopsy appointment was the only appointment I had with her. So we were focused on the biopsy, not really conversation. So the second time I went in, we had more conversation. She got to look at the second ultrasound and kind of compare. She said, so basically the height is the same and the thickness is the same-ish. The thickness is about 2.3 centimeters, so 4 high, 2.3 deep, but the one that changed this time by a centimeter was the width. So it used to be 1.7 centimeters. Now it was over 2.5 in less than 6 months. So that kind of explains why it's bugging me, because it used to be totally I would say it was about right here. It was definitely off center, big Adam's apple. Now, when I put my finger in the very center of my neck, look how much right here, look how much that's pushing on my finger. It's pushing up against it. So the edge of that tumor goes a little bit technically past. My finger has to be right here to not run into it. So yeah, it's growing. And anyway, she kept it short. She said, basically, you're going to have this removed. She's like, it's your body. You can choose when you do it. It's not going to go down. And I was like, well, I heard nodules shrink. And she's like, yeah, all right, yeah, okay. This is not a nodule at this point. It's a tumor that's huge. And it's not normal. Teeny, teeny little, small nodules that are fluid filled are normal and common. What you have is not normal. And the other thing that she pointed out to me, sorry, there's people. Look like a crazy person. Anyway, and then she kind of explained with the fact that it's not going to shrink. It's not a nodule that's going to shrink. It's a tumor and it's going to keep growing. It's been growing for who knows how long, and it's even growing in the last 6 months. And she knew I was kind of against surgery, so she's just trying to let me know and be honest with me. And she just said that basically the smaller it is, the easier it is for them to do surgery. The less risk you have of damaging your voice forever. Your parathyroid glands that are behind the thyroid that, control your calcium. Just the smaller it is, the easier the surgery is, period. What she had explained to me was, while we were looking at my ultrasound and everything, she said, so here is your small butterfly thyroid right here that's normal. And the weight of that is 3 cc, which is normal for that side. This side goes up like this, and the weight of this side is 13 cc. So that kind of explains the extra pressure I've been feeling over here. But I can feel it back here. That's how big it is on this side, the gland. And it's puffy, swollen. Down here underneath, here's the tumor. Underneath it, it doesn't go back in. Over here, I can push in above my well-hidden collarbones. Whatever. Anyway, on this side, I can't go back in right there. It doesn't go back in right there. So it's not just the tumor, it's swollen. The whole gland is massively swollen over here. and it's trying to cross over like the blob and like contaminate the entire organ. So what we're gonna do is she sent me to a surgeon. I did meet with him. My blood pressure was even higher this time, and the nurse had asked me, she's like, are you feeling okay? And I'm like, I don't want to be here. So it was just kind of funny. And then once I start talking to them, I get a little bit relaxed and I think it's fine. But what he explained to me was, yeah, he didn't like the size difference. He felt it and did like a little neck massage to feel everything. He did not, he says, I don't like it. He goes, I'm not, trying to scare you. He said that because it's so hard and because it is complex, where it has both cystic and solid components, it's taking over everything. He didn't like that it grew a centimeter in the last 6 months. He just didn't like it. And he said that they did not get very much out at my biopsy. He's like, you're a perfect candidate for a false biopsy because it's huge, the gland's huge, everything's huge, and it's easy to get a false negative on a biopsy. He's like, I'm not saying you have cancer. I'm just telling you it's where, everything considered, it still could be cancer. He's like, you're not going to know unless you keep either letting it grow on your neck or until you get it out and test it. And he's like, I'm not talking about a full thyroidectomy. We can do a partial and test it. And I said, so you test it while I'm under, and then if it is, you take the rest out. And he's like, no. He's like, I do it different. He likes to test it for like a week and do loads and loads and loads of tests on it just to make sure. So what we're scheduled for, I did end up following through and scheduling with him. Basically, what he's going to do is, because it's in the center and this whole thing has to come out, he said it's probably going to be pretty decent for scars, which I don't care. That's what cover-up's for. So he's going to start about here. And if you notice, I have lines. I've got natural lines, so he can just follow the chubby neck, I guess. So anyway, he'll start right here and go over to about there, he said. Because it is so swollen and big, he's going to have to take it over. Get that whole side out, test it. Well, sew me back up, test it. As long as my parathyroid glands and calcium levels and all that are fine, I'll probably get to the surgery's a couple hours, he said, and then after a couple hours, probably be there for 6-7 hours just to kind of make sure I'm like stable. Send me home. If I'm not stable or they're worried about anything, then they'll keep me. And then I go home at some point, and within a week, they call you and let you know about those results. And he said within a couple days, he leaves slots open for these instances. Within a couple days, he's like, I want you back in and we're going to yank the other half out. So that's kind of my experience with him. He was really nice. He was good at explaining stuff. He made me feel comfortable. I'm getting ready to go into work, and I just thought I would make a video and, just to comfort people in the future that feel like they're the only ones. You're not the only one. I am 30, how old am I? 38? 38. He's like, you're super young and healthy for this surgery. He was saying it's not common for my age for it to be that big. And he just was cute. He kept saying, I don't like it. I don't like it. So we're going to do that. I'll make another video here pretty soon about my surgery. I'll do pre-surgery, post-surgery, 1, 2, 3 days out. Maybe I'll combine it all into one. Maybe I'll break it up. I don't know. But if you're having struggles, you're not alone. Not everybody, but a lot of people I think go through it. So you'll get to follow me if it's something that you're going to consider doing or end up doing. And I hope that by telling my stories of doctors' offices and stuff, it kind of gives you a little idea of what to expect. Most people I don't think would have as bad of a story about the biopsy appointment. Oh, mine was terrible. It was just gross. I'll just keep you guys updated. And anyway, thank you for watching. Bye.